and then the ureter here will collapse on the scope, and you can't see anything because it's constantly. Yeah, so what you want to do when you're looking is inject some water that'll make it open up, and then you can see where you're at. So you need water pressure. Okay. Chromium laser. I didn't bring a laser scope. It's very similar to this, the regular cystoscope. Let's see if I'm. Okay, no, I'm getting ahead of myself. The laser fiber for getting a stone, like once you have the ureteroscope up to the stone, and then you're irrigating with some fluid so you can see where you're going, and then you put this little laser fiber up to the stone. There might be two of them here, but they're just tiny little lasers, little fibers that transmit the laser through that. And then you can see if you have a stone that's this size and you're attacking it with a laser this size, you're going to just, it'll take you a while to break it up and then fish all the pieces out. But this is very flexible. It goes through the either scope straight, or it'll turn and it'll bend wherever you want it to go.
That's a fiber?
A laser fiber, yeah.
Is it a multi-use one? Or a...
This, it is, because this is all we use at the center up north. I think the hospitals require fresh fibers every time they come in.
If you're using laser fiber and it breaks into pieces, wouldn't those pieces just flow down with the urine then, or do you have to scoop them out?
Well, they typically scoop them out to make sure that they don't leave any sizable pieces. So, of course, the little ones, the little tiny little ones, are going to just flush out, but they go after the big ones to make sure that they're not going to cause a problem.
And our stones, is that a realistic size stone? Or is that big?
It's big. My ureter here is not realistic.
Okay.
It's probably
It's enlarged.
3 or 4 times the size that it should be, but I was limited to tubing. All right. Oh, and there are. Well, I did show the baskets. Laser. And of course, when you do a laser, you have to be very careful about the safety, because it could burn material. You have to wear glasses in case you get hit in the eye with the laser beam. You can't blink fast enough to save your eye, so you have to wear glasses. Some of the doctors don't, and there's debate on whether they need to if the laser is inside the body. So. Okay.
But usually the chromium laser is used on the ureter, not on the kidney, right? Because I saw usually.
Usually we do.
On the ureter.
Yes.
I mean, you know, not on the kidney.
Only when
Or the bladder.
Or the bladder, but
Yeah.
the bladder, but not to the kidney, right?
Well, they do. We have. That's why we have the flexible ones, so you can get up into the kidney and break up a stone and then pull out the pieces.
Mm-hmm.
So with the scope, which I'll show you in a minute, we'll actually go down and get stones, but it's a real tedious process, locating it and breaking it up. Flexible. Now this is this is our backup scope. This is the fiber optic. It's not the good digital. But still pretty, it's a still pretty nice scope. The digital is the one that's really expensive. You can see that even though this is much, well, it's about the same size as the original. But, and this image is okay, you can still see like little pixelations there. But the digital one is just clean as can be. And then when you actually see a stone, see my stone.
You did?
There it is.
Oh my God.
That's a real stone?
That's a
You actually
soft.
put a stone in there?
Yeah. And then once you're up into the kidney, and
It just falls out.
it falls. I don't know why they have so much trouble. But see how you can get down into a ureter here. You can go anywhere you want with this thing.
Oh, so you can get it to bend down like that?
Yeah.
Oh, okay.
So the laser fiber will bend, and then you can go after it.
Okay.
And then the baskets, of course, will bend. So that's what they're doing, is getting little pieces out with that.
So why would they not use a flexible scope in the beginning, not to, have any issues with perforation of the ureter and, I mean, what's the purpose of using the rigid ones?
Well, because of the length of it, if you're working in the
Okay.
ureter here, the rigid is much easier. This is like a nightmare trying to balance everything.
Okay.
You're putting in, you have another device here. Well, water in here, and you got your baskets, and you're just balancing everything. And the rigid scope that we have is just very nice, a beautiful image. And
So the proximity basically, okay.
yeah, so it's much easier to use. You just be careful, you follow the wire up, and then you won't get into any trouble. So, and then also, just to double check, once you're up there, you can also inject dye through this to make, just to double check, make sure everything's clean. You can put wires through here, and the wires up if you want to put the basket in. That does stick. So, okay, good. One thing I forgot here. Here's a urethrodilatator. So once the ureter, once you have the basic scope in, then you're in place here. Then what you do is pass this through the scope and into here. If you want to dilate the ureter, this has like it starts out very narrow and then it gets wider and wider. So that's all you have to dilate a ureter sometimes. And a ureter is actually probably about this big. So you want to dilate it so that you can get one of these scopes in.
How does that dilate it? Just by touching it or going in there?
Well, yeah, just by going in, you force it in, and then you go from a narrow area to this wider area. And that's all you have to do.
And then you just take that back out?
Then you take it out and it's dilated. It's an easy process, but that's, so you have to do that sometimes in order to get the scope in. And then here is the dual lumen catheter. This one is used for putting in 2 wires. A lot of times they put one wire in so they can follow it up, and then they put a second one in. Sometimes it's hard to get in here, so they'll put a second wire in. They can just put them right in through here, take it out, they have 2 wires in.
Oh, I see.
So, then a
But what in this
sorry?
what in this for,
2 wires for safety, in case, one wire you use to follow up into the kidney so that you don't accidentally take a U-turn and go outside. And then the other one, in case one falls out, you got another one. It's a safety wire. Because once you get in the ureter, it gets a little bit irritated, and so you have to be very careful. If you lose 2 wires, you may be done for the day. So. And then this is the access sheet.
Okay.
So what this does, you go, and there's a wire, right? You usually put this over the wire, and that's what gets you inside the ureter here. So then you take this out, and what usually happens with the access sheath is you're getting into the ureter where you want to go without having to find anything again.
So like guides you in there.
Yeah, so I'm gonna go after this stone right here. I got it in a basket, I pull it right out here. You know, put the stone in a cup, I go right back in and go get some more pieces. So it's just a way to give you access.
Why wouldn't we use that on all patients, an access sheet to keep it easier or?
Because some stones are, go up and get it and you're done.
Mhm.
So not everybody would need an access sheet like that. It's,
Is it for like multiple stones or?
multiple or big stones, where you know you're gonna go, keep going in and out, in and out.
And access, it's only for flexible? Or it can be used with rigid, the rigid one?
It could be used with rigid, but they tend to use it with the flexible one.
Like the ureteroscope, right? And when they do ureteroscopies, they do it more?
Yeah, well, yeah,
This is a ureteroscopy.
this is ureteroscopy, and this is.
So we have a flexible cystoscope and a flexible ureteroscope, right?
We do.
Okay.
Do people use that much?
I see them write flexible
Flexible
cystos
cystoscope.
sometimes.
Flexible, okay,
So that's a flexible cystoscope, right?
yeah, and I'll show you that. And the reason why they use the flexible cystoscope is, we mainly use it just to take stents out. Like if there's the stent sitting in the bladder, rather than when you put a regular cystoscope in, you have to put the legs up, and they have to be in a certain position to use the scope. With the flexible cystoscope, it's kind of like a short, stubby ureteroscope, and it does pretty much the same, but it won't go it won't go up into the ureter usually. It's too thick, so it goes into the bladder, and then they put a basket in there, grab the stent, and pull it out. So I think they use this mostly just for stent removal.
Makes sense.
Yeah, this is big, it wouldn't fit up the ureter there at all. So, and they could use something like this in the doctor's office too. Much more comfortable than putting in that big steel rod. So, here's one other thing here. The device you've all been waiting for. This is the ELIC.
Okay.
ELIC evacuator.
That's after the Pathfinder, huh?
The Pathfinder gives fluid. If you have a big bladder stone, you're gonna have chunks galore down there. So what some guys like is this little evacuator. This is in the bladder, and then you just pump it, and the urine and the urine comes in here, stone pieces fall down to the bottom. So you just keep pumping.
This a new supply? I just recently seen that one, the evacuator.
Well, they've been around for years, and we only, and we didn't really carry them. We always told the doctor, you
Okay.
know, use a 4 set of 30. They would use a Toomey syringe
Oh.
and irrigate it, but, you know, I try to be a little nice and get little toys.
More than.
So this is for getting, the Elec evacuator is for getting big pieces out of the bladder.
Okay.
And, let's see, what other toys we got here. That's just a ureteral catheter. Okay, blue one, basket. That's right, okay. And then after ureteroscopy, like I say, it gets a little bit raw, and then even if there's no stone, this could be irritated enough to close off the urine, and it could cause symptoms of like a stone blockage. So you put it in a stent, you don't have to worry about it, because the urine is constantly moving through the system there.
How long does the stent stay in?
For ureteroscopy, it could come out the next day. For stones, usually they'll put it in, break up the stone, and then let the pieces pass. And if they take an X-ray that's clear, then they schedule them to take it out. So usually about a week.
And is that done in the doctor's office or do
Yeah.
they come back?
No, they don't come back to us. Yeah, it's done in the doctor's office. Okay. The prostate. Like I said, they say it's like a walnut-sized object. And we do XPS at our centers to take care of the prostate. There is one better diagram. If you close that down. And click on, let's see it. Is that? Oh, that's it. You can see that the tip of the scope is by the prostate.
You're gonna have to close your board, you have to close your board, Bob, they
Sorry.
can't see.
See that?
Yes.
So here's the bladder, and then here's the prostate. Here's the urethra, goes out here. And so this is your walnut-sized prostate, and normally it, when it expands, it will expand this way, because prostates are, good.
Okay.
They're continually growing, and they will just squeeze the ureter so you can't get the flow out anymore. So what you do with the resectoscope with the button, they're using buttons now. We use the XPS laser and the cyber laser. What you do is you get in there and you go right through the wall of the ureter here and just carve out a little tunnel here. You can't get it all out, but you just carve it out, make a nice big opening, and then it doesn't obstruct the urine flow anymore.
So you basically destroy,
Pardon me? Well, there's a couple ways you can do it. The old-fashioned, not the old-fashioned way, it's still a good way, is the TUR, the resection of the prostate. And, let's see. I have it there. This is the equipment for that. It looks like a little cystoscope. You get it into the bladder first. And then add this little device here, plus a lens, which This is an old one, 2 different makes, but the lens will fit in here, and then this moves back and forth. You see like a little loop at the end of it. So what they do, and it's electrified too. So what happens is you move this back and forth and you just carve out chunks of prostate.
Where do those chunks go? They get irrigated out?
They get irrigated into the bladder. And then I probably could use an Elic for that. Huh? But so this is the cautery loop. It's you have to ground the patient to this, so there's electricity, there's current going through the body, and
It's the TUR?
TUR.
Cause I see, they call it TURP, right?
Yeah,
TURP?
TURP.
Okay.
It's transurethral resection, P for
Over.
prostate.
Okay.
And so that's the main way that the older doctors, I think they still do it occasionally, this right here. But the better way is to use like a button. Well, this isn't quite a button. This is called a roller ball. But the button is very similar, and I think there's a picture of the button there too.
Your pictures?
So what this is a hot button. You just roll it over the tissue and it just melts it away.
So that's what the button is?
That's what the button does.
And is that
There
used
it
with
is.
like the XPS machine, right?
Sorry?
The XPS machine, we use the button?
No.
It's totally separate machine?
Separate machine. It's a electrical generator, so you put electricity through this, and it heats this up, and it'll just burn. The button is a little bit bigger, and plus the current comes in, heats it up, the current goes out, there's no current through the body. So it just heats right where it's touching. So that's why they like the button. It's supposed to give less side effects than something like this.
And that breaks through the ureter to the prostate?
Urethra.
The urethra?
The urethra, yeah.
Yeah, actually, when you're carving right through the urethra, and so the lining of the prostate now becomes the urethra. It scars over, and that's your new channel. It
That looks great. Even that.
this, yeah. So that's the button. They have a separate generator for that. This is a different generator for this. Everything is proprietary. Yeah. And then we have the holmium or cyber laser for doing prostates. Same thing. The only difference is the tip of this laser fiber heats up, and so that acts kind of like that ball does. It just you touch the tissue and it just melts it away, kind of like a hot poker.
So how much of the prostate are they actually taking away? Like if you go back to your prostate photo?
You go back to that.
There's pictures, the prostate.
Back to the prostate
Well,
picture.
typically, it's held in that capsule, and all the tissue really, they won't get it all. The only thing they'll get it all is surgery to actually remove the entire gland. So they do leave a little lining here of the prostate, so it doesn't prevent you from getting cancer either. You can still, this will still grow, but usually you're good for about 15 years. So,
And are they cutting away both sides with the laser?
yes.
Okay.
They always talk about a middle lobe if you ever read the op reports. The middle lobe is this little flap here that always gets in the way. That's the big headache. And then these lobes on the side, they always go the left side and the right side. And for some reason, the upper part never really becomes an issue. So usually the side and the middle.
So what is the average age for a man to have this procedure?
They're typical, you could start having problems in your late 40s and 50s, but it's not as, because if you have a history or a fast-growing prostate, but usually when you're in your 60s, then you start feeling side effects. Most of the patients are 60, 70, but occasionally we'll get someone much younger.
And there's no preventative measures that you can take to,
No, I think they get medication to kind of like relax things, you know, it's, but any prevention, it's just something that's gonna happen. It's like your hair, well, most people's hair grows.
first grade.
Do you have an XPS, do you have an XPS fiber?
I do.
All of them are flexible?
Sorry?
All of them? Fibers, all of them are flexible?
Yes, but this little fiber here, that has to go up into the kidney. This one just has to go just right here at the prostate, so it's not as flexible. You have to be careful with this.
So what's the difference between XPS and fiber on the prostate?
The fiber. This, you actually get a laser beam coming out at an angle here, and then when you point it at the prostate tissue, it melts it like butter. And you don't touch the prostate, it's just the laser beam that melts it. With
That's
the
why it's called a green light, right?
green light, yeah. And then with the cyber is basically a holmium type laser. What it does is just heat the end. There's no emission of laser beams from this thing. It heats up the end and you use it like a hot butter knife. And you just carve out the prostate. So this one is a nice little beam, this one is a butter knife. They do basically the same thing.
And is the reason this treatment is not effective for cancer because it doesn't get the whole gland?
Correct. A lot of times, well, yeah, they always have to be careful to screen for cancer before they start doing this too. So make sure that there's no cancer in there, and then because you could be removing the cancer and then you wouldn't even know that you had it. So you got to do a workup for cancer before you remove the tissue.
Wouldn't that be a good thing because essentially you're killing the cancer by burning it?
I would think so, but I don't think it eliminates the possibility of little cells growing in there
Okay.
somewhere. So if there's one nodule, there could be other little ones growing in there too, so you have to be careful.
We have a few doctors that prefer the HPS fiber with the XPS machine. Do you know what's the difference between them?
The XPS and
The HPS? The old
HPS.
HPS fibers?
the HPS, which is basically is the similar, you know, the laser beam comes out the end of the fiber here. The same for the HPS, which is high-powered laser machine, and this is the extra power, I guess. It's the same. The only thing is they put a cooling channel in here so that you could turn up the power a lot more in the XPS because you're administering some cooling to it. So the HPS fibers, if you use them too long, and they heat up, they'll blow off. The tip will blow off. So this is a much more durable fiber. And I think that I think they use this mostly now, maybe in the doctor's office.
Some of the mobile sites, the docs prefer the HPS. A couple, just a few docs, a couple mobile, just a few mobile docs.
This is so much
They're not using a
nicer.
machine, but they prefer the HPS fiber over the XPS fiber. They'll use an HPS fiber with an XPS
Yeah,
machine.
it's basically the same. Like I say, this one, you can just go a lot higher in the power. Maybe they don't care to go up to a higher power. They're okay with using the lower setting. Sure.
PowerPoint?
Let's see, what's left? Well, click on this one up here. You know what, I don't think there's sound, actually. I'll give you an idea. If you can hit the light real quick. Go ahead and play that. This is up in the kidney.
Where will I find
Oh, it's on the bottom. You may have to
Gotta move
Well, you
it.
have to look it up.
lift it up. But one of the doctors got the flexible ureteroscope into the kidney.
You gotta move it up.
it won't move?
Yeah, you have to click on the top.
Look on the top part right there.
This one.
And then,
Drag it.
and then drag it.
Use your finger on there, right, yeah.
I'm trying it, I'm moving.
There you go.
Okay.
There you go. There, now, the bottom is the,
Yeah, I'm moving it all over the place.
put it up high and then click on it once more.
Okay, got it, okay.
Click. No, go.
Expand
There you
it
go.
There,
there.
I can see here to display.
So you'll see that a little stone, these are the calyces of the kidney, and right there, surrounded by a little bit of blood clot, is that stone.
You can expand and kind of make it bigger.
So, and that stone was only, gosh, it was tiny,
But
but it looks,
Not making it any bigger or anything.
play it again.
it looks big on there, but, you know, it could have been like a 2 millimeter stone. But that's how nice our image is with the digital scope. And then, let's see, what else?
Do you want to make pictures or?
Yeah.
Which picture?
Oh, I'm sorry, can you go back to the
PowerPoint.
PowerPoint, yeah.
Just close it.
And we're at the laseroscope.
Oh,
Like this one.
oh, we sent this, oh, I did talk about all of that already.
Okay, I'll go down.
Okay, so that's
Circumcision.
kind of what we do at the centers here.
We see the
Now, the new procedures, which I think they're only doing in New Mexico, circumcision, varicocele, hydrocele. Is that basically it?
I think so, and button.
Good job.
Can you talk about hydrocele?
Okay, so
Yes.
you can go back to the pictures.
Pictures. Okay, which picture do you want me to go to? Which picture?
Let's see. Well, yeah, that was their setup, you know, just the disposable things. Yeah, you can just